Good morning and welcome again. This is Addiction Counselor Ethics brought to you by the Northeast Caribbean Addiction Technology Transfer Centers. My name is Diane Padilla and I will be working with you for the next little while for the next few hours. So just a brief plug for who is funding us. We're funded by SAMHSA and we are, as a regional training center, we cover Region 2 or HHS Region 2, which is really Puerto Rico, New York, Puerto Rico, the Virgin Islands, New York, and New Jersey. So we provide free, and let me say that again, we provide free, both virtual and in-person trainings specific to topics that you need to keep your credentials, specific to enhancing your capacities, just so you can do all that great work and keep your credentials, because that we need you to have those. So we're SAMHSA's response to workforce support for you. And so everything is research-based or evidence-based. It's always about best practices. We tend not to endorse dated practice. It's really about keeping you updated with what is currently considered best practices. And we'll see how that speaks to in terms of the capacity, in terms of the content that we're going to cover today. Let me see. Language matters. The slide is over here. One of the things we do try to practice and encourage on yours, encourage all of you and practice on these web trainings, both in person and virtual, is that we try to practice or mimic the language, recovery-oriented language. So we try to be stigma-free in our approaches and our concepts in terms of the terminology, and that takes practice. You know, we don't always get it. We don't necessarily get it 110% right all the time, but we can make a commitment to be more intentional with our wordings. So this slide is important because this is really speaking to the stigma that keeps people from accessing care. And then it's also applicable for folks that we have in care in terms of retention. And so the words we use matter. The words have an impact. Our intentions don't, but the words do for folks. And so we always strive to encourage recovery-oriented language. So important information. So in terms of this particular web training, for New York State Office of Addiction Services and Supports, in terms of the state that this is coming from, you will be able to get 3 hours of continuing education credits for the for prevention and addiction counseling, which is for KSAT, CPP, and CPS. And there is reciprocity across the states with this. This is also, there is also availability of 3 hours towards social work credits for LCSWs and LMSWs. So what we'll do is, before the end of the session, in case you haven't been here before, a few minutes before, and we're here from 9:30 to 12:30 Eastern time. And so a few minutes before the end of the time, because I don't like to take more than the time that we asked you to stay committed to this, I'll give you a couple of minutes so you can fill out an evaluation for us. That is so important. And so for you, that's part of how we count your attendance. The certificates, let me step out of here for a moment. So the certificates of completion are contingent upon your attendance. Your attendance here, there's different ways that we try to note it to assure that you're present. Part of the challenge here is that folks log on and then step off. You know how we see it? Because every time I have an activity and we put you folks in breakout groups, and you'll have a couple today, a few of those today, is you don't participate, you're not there. So I just want to let you know ahead of time that I have colleagues here, and they're the ones who take care of the administrative aspects, including the certificates that you'll get anywhere between a day and a week. And part of your participation, or at least of being available to even be in a group, even if you don't want to participate specifically in that activity, that's part of how we count that you're here. So just so you know. So I don't do that part. I just do the trainings. But my colleagues take care of the other administrative logistics. And so I just want to give you a heads up. And that's part of the reason why we ask you to be visible, because the state, the accredited entity in the state, which is OASIS, New York State OASIS, they require that we make sure that we have proof that you were here. So all that's to say is that if you can help us out, we'll help you out, because I know you didn't need the 3 hours, the 3 hour credits if you're an addiction counselor credentialed in New York State. So this will meet at least 3 hours of the required I believe it's still 6 hours of ethics that you need for not just the initial, but renewal. And so this will cover 3 hours of that. We also do sometimes professional boundaries. My colleague tends to do that one. That would also apply towards the ethics requirement for recredentialing. So just in case. The other thing is when we have a nice group like this, uh, we can get very involved in certain conversations. This is one of the few trainings that I would say that is relevant so specifically to what you do in your capacity in your setting, that is so much opportunity to speak on different aspects of situations we come across. So this is a great place to have your voice heard. The other part of having your voice heard is that I would like your voice not to be interjected by another voice. So I'm asking everybody to just raise their electronic hand. How's that? Can you do that? Show me that you can do that. Because I only see like 25 people or 20 people at a time. So very cool. Very, very cool. Thank you. So that way we also don't miss a voice. There is so much experience on this platform. I'm simply here to guide you through the different dynamics that have to do with ethics, because we know that there's no templated approach of applying ethics in most areas. And so that's what we're going to. So we're going to speak on it from a few different perspectives, certainly from your experience. So I'm encouraging everybody to participate to the degree that you're comfortable, but also not to talk over anyone else's voice. So very cool. Excellent. So what else do I have to say? It would be helpful to just use the I perspective, especially. There have been times where providers have brought up situations where it's been unique to the dynamics in their area, their setting with those circumstances, and what the organization requires or allows the professional to encourages a professional to do and not do. And so it might look different in different areas. So let's keep an open mind to how different settings and different details can be very, does not necessarily look the same for every single person. So thanks, everybody. Any questions that you folks may have? Okay, so we may not be super excited by ethics, but we can be super excited that this at least take up half the day because we're getting closer to our weekend. Is that okay? Got to get that smile back up. Okay. All right, so let me just share a little bit of information here before we start diving into this conversation. So the goals: recognize the importance of ethical professional practice. It's all about ensuring the person's wellness. It's about we are always mindful of their health and their well-being. So it's about whether it's healthy, safety, and I should have put safety first, but it's really about helping to people who are recovering from substance use disorders or mental health disorders, or a combination of different things, and being able to practice ethical principles that can help us discern between different questionable situations. And so recognize the importance of ethical standards as a professional to deliver highest quality care service to clients. And that should have been just a given. So first question, not the first question. Let me put this here. I think I can do this. So, okay. So I put in the chat box, New York State OASIS, CASAC Canon of Ethical Principles. If you're here from a different state, I'm not sure that it would look the same. Please just check with your accrediting entity in your state, just to ensure that that you're abiding by the principles that you signed up for. Addiction counselors who are credentialed as CASAC, Certified Addiction, Substance Abuse, and substance abuse counselors, they are one of the things what we had to do after we did trainings, when we got into the field, is before we got our credentials, we had to sign up. We had to make sure we were familiar with these ethical principles as dictated by New York State. And we had to sign a piece of paper saying we were going to adhere to these. So this is the foundational to all the content we're going to cover today. The same applies in any state that you're at. There are certain principles of the discipline that you have to adhere to, and you pledge to do that, when you sign up for this kind of for this type of profession. So we're going to cover the definitions, situational concerns, and hopefully ethics and wellness overall. So, question, and let's just start here. What do you think? I mean, this may be a no-brainer, but what does ethics mean to you?
What's expected? Identify, I guess, a little bit some of your a moral belief, so to speak. What I should abide by, what's ethical, what you should and shouldn't do.
Okay.
How to engage, how not to engage.
Yeah, I guess that's not a bad way to put it. It's like kind of simplifies it when you Jamaica. Did I say that right? Okay,
Yes, ma'am.
All right, Jamaica. So it was at the end of the day, it's always about what's the do's and don'ts. And so, and then the do's and don'ts, and says, so that's a great place to start. And let's start to kind of unpack that a little bit more. Erin, good morning. What would you like to add?
Good morning. I think ethics to me means being able to treat people in a way where they feel heard, they feel respected, and they feel that you understand them, and that you know that their perspective is they're being heard.
I agree with that too. Thank you, Erin. Cassandra?
For me, it's like some guiding principles on handling specific situations that might happen, whether it's confidentiality, whether it's being objective, subjective, or following the guidelines of your particular agency or those things. But it's like the guiding principles for taking care of our clients.
Thank you so much, Cassandra. That's a nicely put as well. And so a lot of folks agree with you, with y'all. Ethics is inner compass to help you decide what you should do, especially when it's not that obvious. It's also the do's and don'ts. Let me see what right and wrong, so to speak. There is professional practice with core principles to assist individuals in need, operating with fidelity and scrutiny. I like that. Jacqueline, what would you like to add? Good morning.
Hi, good morning. I would say looking at dual relationships and boundaries as well.
Mm-hmm. That's included in there too. That's right. It's going to come out in so many different types of situations. And that's what we're going to do is look at situations from different perspectives, because everything that everyone has mentioned is applicable. It's still more. Antonio, good morning.
Grand Rising, Grand Rising. For me, I have two different perspectives, but another perspective I have is protecting the profession, protecting the counselor, and protecting the client.
Okay, yeah, that's part of it too, for sure. Thank you. All right, so let me just bring up, and thanks for the responses. That's a good place to start. Let's cover ethics. So from a broad sense, it's an idea or concept of morality, and it was mentioned before. I remember, I know Cassandra had mentioned guiding principles, and so, and I think emphasis on the guiding. So morality can be subjective, but when it comes to this discipline, when it comes to working with people with substance use disorder, it becomes very much more defined. So it is about right and wrong. This aligns with everything that was said and everything that was put in the chat box, and what constitutes a good life for the individual you're working with. So those moral principles guide human behavior. And that means, as from the professional perspective, from addiction counseling perspective, is how they interact with an individual, the actions they put in behind the care and support that they give any given individual that they're working with. So the canon of ethical principles, specifically for New York State OASIS, is considered a set of guidelines that help facilitate the obligations for the CASAC person or the prevention alcoholism and substance abuse counselor. And so in that, it's always about providing the highest quality of care to any given individual, always ensuring their safety and welfare. And so very well. So this is a good place to start. So here I'm going to ask you all, let me see if I can put this in the chat box. I'm going to put you in groups, and I'll bring something up. First, I want to give you a handout. Let's do a kind of icebreaker here. I'm working with a mouse that works when it feels like. Okay, so now I put it in the chat box. See if everybody can click on that handout and open it up. If you can save it to your desktop, it's great. If you just want to leave it open, that's fine. So I'm going to go back to my slides here. So what I'm going to ask you to do is you're going to be put into breakout groups, the small group activity, which is really speaking to ethical principles. So you will have this, the handout has these different definitions of ethical principles, and you will have an index to work with. And as a group, what I'd like you to do is put the right name, label, or the principle before the definition on the side of it. So you will have 12 minutes to do that. So everybody's writing, so like it kind of got, sometimes you have to scroll up because like everybody's getting involved, which is amazing. So now you all have the handouts. You're going to work for 12 minutes. You're going to work as a group in groups of, I believe, five or six. Whatever Clyde put, whatever number Clyde decides to put you in, that's my silent partner. And you're going to work to match up the name of the ethical principle to the definition that's already quoted on the paper. Okay. And so you're going to click, give a join button and join your group. Again, remember what I was saying. You may not want to actually participate in a group activity, but if you don't click on join and go into the group, it seems like you're not here. Okay, so I give you kind of partial choice. I want to respect your choice. I also need to make sure that you are here. So once you get the click join button, then we do that. Okay. All righty. So now you see the join buttons. Please click on that, and I'll see you in 12 minutes. Nice to see you. Gosh, still doing the do, huh? So, Erin, what did you want to ask a question? Erin?
Oh, I was just raising my hand to start the conversation.
All right, so we have this. I'm gonna also put this up, and please do not chime in. Please try to raise your hands. We're gonna try to do this way. And so, I know I put you in different groups. I know I don't want to process by group. I just wanted you to start having a conversation with each other. You have different perspectives. Sometimes you're working in the same state, sometimes you're working in another state, but there's some common elements here that we can probably work with or identify in terms of this context, which is part of what you need to be to keep a front end for the work that you do. Okay. So for the first one, refers to proactive support and action for the benefit of the client with intention to improve their situation. What was the answer to that one? Erin, you're going to lead us off.
Our group decided it was B, and I think that one was kind of easy because it says benefit, and then that is also in the term.
Yeah, I guess I give you a little bit to go on. Thank you, Erin. Anyone else had anything different? Okay, so let's work with this. Like Erin said, it's B. B being beneficence, being the ethical principle that applies here. Now I'm going to ask someone else to speak to the second one, read it, and then identify the ethical principle. Erin Doyle. Hi.
Hi. Assumes impartiality in service provision. It means that a counselor will treat all clients equitably and give everyone their due portion of services. And we said D, justice.
Exactly.
Focusing on service provision and all clients and everybody getting their due portion.
Okay, very good. Thank you so much. Here's what, so I'm just gonna get out of here for just a minute. Dante, did you have something different?
Oh, I was on mute. No, I didn't have nothing different. I just wanted to know because you had the letter, but not the word matching the letter. So I was just like, I wanted to know like what was the.
You're right. Next time I'll put that in activity. So D was, but it's in your handout. So D is, Erin, what did you say D was?
Justice.
Justice, okay?
Yes.
So we're going to justice. So what you could do, Dante, and everybody else, you could kind of maybe just write it in, make a quick notation on the side. I'll give that to you more spelled out when we give you send you the PowerPoints.
Okay.
So I wanted to ask a question about that particular one because it says assumes impartiality service provision. It talks about equitably. What's the difference between equality and equitably? Equal, providing equal services and providing equitable services, because yeah, the wording can be very confusing. Erin?
Equality is providing the same for everything, and equitability is providing what that person needs to be able to have a level of sameness.
Okay, thank you. So the whole idea there is, and that's why equitably is there. There's some dated sources that would have equal, and it's not necessarily true because we're supposed to be using person-centered approaches to be able to meet the needs of each individual, which doesn't look the same. Part of the problem with some of the systems that we have to work with is that the fact is it's not tailored. We have to kind of navigate through everything to make sure that it's that it would be that we can provide access to resources that will meet the needs of the individual. So I just wanted to make sure we kind of point that out as part of the justice piece. So it's not just equality. Okay, so how about for, let me see. So we got, let me see, I'm gonna keep this back up. So this was justice. What about the next one? What did you folks have for that?
Refers to the degree in which a program or professional adheres to a specific standards defined for that discipline. We put E for that one, fidelity.
Okay, fidelity. Thank you so much. That's the correct answer. Did anybody have a different response for that one? So does anybody want to elaborate a little bit more on what we mean by fidelity to adhering to program services, to how the program services roll out, or professional standards even? Anybody want to add a point to that?
Well, this is Louisa, for instance, with being able to provide a program. I do a lot of prevention programming at our schools in Sullivan County. And we use, for instance, the program Too Good for Drugs. And so we need to basically adhere to what the lesson plans are, but that doesn't mean that we need to follow it word for word, because we also have to take into account what's happening amongst the students who are participating. You know, some might gravitate towards the information, some might not. You need to be able to work fundamentally with the program faithfully, but at the same time understand the audience you are working with.
Well, it sounds like you, yeah, it sounds like you're also trying to make sure that they're tailored according to their needs. So, but still working within the program parameters.
Yeah.
So thank you for that. For people who are familiar with the credentialing process in New York State, just a quick question about that. When you're a KSAC-T and you're a KSAC, can you do the same kind of work?
Yes.
So can a KSAC-T work with someone who may have co-occurring disorders in terms of referral, or can someone with a KSAC-T not do that? I'm not trying to give you a trick question, just kind of want you to think about, you know, I know they say, and I hate this line about staying in your lane, but the reality is we're supposed to be credentialed to work with a very vulnerable population with different issues for a reason. We're very specific, especially the entities that accredit us, that credential us, that we're very specific in what capacity we can serve any given time. If someone's just getting new into the field and just got the 350-hour program that is required by this New York State, or whatever's required in your state, and you are in the early stages of experience, a KSAC team may not be able to work with someone who has extensive trauma history with severe levels of substance use disorder. So why I'm saying that is because when we're thinking about fidelity, is adhering to um, professional practice. It also is about what your capacity is and how you can serve. And so somebody more experienced who has the full credentials and, is unlikely to have the opportunity to work with someone who has very severe levels of needs with substance use and maybe another co-occurring disorder, even though they're not being a mental health specialist, they're still working with them more than somebody who's just getting into the field. So I hope that's clear enough. It's just the reality that we want to make sure that we adhere to our professional standards. For instance, addiction counselors, you folks, are you going to be the medical providers? Are you going to be the medical people that provide medical information and support or medical education? If you're working, if your hat says addiction counselor. So fidelity here really speaks to what you can do within your capacity, and that's how, and to the degree of professionalism and capacity that you're supposed to be serving in, and not stepping outside of that. So that has to do with it. Now, I'm not saying that someone who has multiple credentials can't work to different degrees. But when we're speaking about just addiction counseling, that has a very specific parameter. So let me put this. Fidelity for counselors committed to being loyal, trustworthy, faithful to a therapeutic relationship, ethical. Okay. So what's the next one? Who wants to do the next one? Cassandra, please read it and then identify the ethical principle.
Okay. The principle of do no harm is a holistic perspective that is equally focused on both harm and benefit. It reminds us to think before rushing to do good. And we chose C, non-maleficence, for that one.
Yes, and I agree with you too. Non-maleficence. It's kind of so thank you, Cassandra. We tend to think about like beneficence and maleficence as two sides of the same coin, but it actually, that's just a simplistic way of looking at it, but it can go deeper than that when we start to look at the various details depending on the situation. So thank you for that. So what about the last one? Who would like to try to take that out?
Yeah, I had my hand up. I just didn't remember that. I'm thinking that A was autonomy. I didn't have I was trying to get back to the sheet, but as professionals, we are obliged to respect and support clients' decisions for those who have the capacity to do so.
Okay, and so yeah, and that would be the correct answer. Would
It's
be
going on memory. Okay.
Yeah, so thank you. A for autonomy. Autonomy is key. The autonomy, the voice of the person. And so what do we call a client's ability or capacity to make decisions for themselves? What do we call that?
Self-determination.
There you go. Self-determination. Excellent. And so that's something that, okay, that's very specific in social work, but it's also very relevant in terms of counseling. And so it's the person's ability, because how do we distinguish what would be helpful for the person, would not be helpful for the person if they're not able to make decisions for themselves? And so there every once in a while we do have someone, a client or a patient whose mental capacity might be compromised for one reason or another. And so those are things, that's why the questions of ethics kind of comes up. So thanks everybody for doing this. I really appreciate this. The whole idea, we're going to do one more breakout group. So we got to try to get the technology right. And we'll try to help you. Just want you, when you take a join button, you press on it. And remember what group you are put in case you get kicked out. So the basic ethical principles, this is just foundation to the content that we're going to consider covering. There's going to be another couple of principles that gets mentioned in our initial training or retraining for renewal of our credentials. And so they'll come up here. All of these are foundational to the decisions that we make, or the next steps that we're going to, or influences the next steps we're going to take when we have certain dilemmas that we need that are coming up when it comes to, situations with our clients. So part of the reason why the accrediting entities want us to stay familiar with these concepts. So beneficence, we spoke about, assumes responsibility to enhance the welfare of others. It's one side of the coin where it says do good. It's to benefit the other person. It doesn't mean that we make the decision. It means, it does mean that the efforts are invested in their wellness. Justice, we talked about, impartiality, it's more spoken to here. We just went through it. fidelity improves, involves using program-specific standards and strategies. Is also how you practice and adhere to the ethical principles of your profession. Non-maleficence, we went through it. So this is all spelled out, and you'll have this as your handouts as you get it, just in case you need a cheat sheet. Non-maleficence is the do no harm concept, and autonomy is about celebrating and honoring the person's voice. And so, yeah, self-determination is a key factor here. We have worked with clients with different health issues, with different challenges that may have compromised their ability to make healthy decisions. And sometimes, and we don't want to confuse that. Like for instance, if we're working with an older adult, older adults process information just like anybody else. We might need to be a little bit patient, but they can still self-determine to a certain degree, to a very large group of them can still self-determine. They might just respond slower. We don't want to confuse different dynamics of interactions with our clients, thinking that they can't even process this information. So those are the principles. So primary functions of code of ethics, that's to safeguard the welfare of the person, their well-being. It's also, and I wanted to kind of just tap on a little bit of what Anthony said also, because another side of another coin also includes, it also protects you. It protects your agency, but it protects you as a professional. Because although you're working within the capacity of your agency and you're actually a representative of theirs, it's also your profession, because you take you and your credentials and your profession with you wherever you go. You don't always stay in the same agency. So ethics help protect you too. And so it includes confidentiality, guarding the person's privacy and what that looks like. We can talk about that later. Quality of service, maintaining quality of service is especially important. We want to do the best we can to provide the highest quality of care. And the thing is, it says present honestly the professional's qualifications. And so, and that's interesting because there have been different times when I was doing direct services where folks have been hired with the understanding of certain credentials and then didn't really have them. And so that's really important because that causes a liability issue on the part of the organization. It also is a big issue, and I should have probably said that first, is the liability issue for clients, because then if the organization can't assert that you have the capacity, the knowledge that you need to have to work with certain clients at certain degrees with certain conditions, then you're actually putting somebody in harm's way. And so all of these are really, really, really relevant to what we do. So principles one and two, let me go over that. Must practice, so these are the 20 principles of canon of ethics according to New York State. These should sound very familiar for anybody, no matter what state you're in. So the first principle is must practice objectivity and integrity, maintain the highest standard in the services provided, respect the values, attitude, and opinions of others, provide services only in an appropriate professional relationship. And so in order to do that, so there, sometimes I am doing, how do we ensure that we're always practicing to the benefit of or the welfare of the individual? What are some of the things that we do that helps ensure our objectivity? Erin.
We ask the client how they feel about the services that are being provided and if there's anything missing for them.
Okay, we can ask them directly. Yeah, sure. Jamaica, what would you like to add?
I was going to ask, so I'll just state in as a practitioner to remain in the scholar practitioner mindset, that you're always making sure that you're up to date on what's evidence-based, or you're ensuring that you're delivering what is, I might have you some in vogue or whatever at the time. So
I like that you mentioned that. I really appreciate that because one of the things I mentioned early on, and I'm going to be repeating that anytime I do any kind of a training, is the fact that we here at our organization, part of how we adhere, use the fidelity concept is we try to, we're doing darndest to bring you the most innovative, the most current evidence-based practices and approaches. And so I'm not going to tell you something that was appropriate for, say, 10, 15 years ago. research has evolved and our experience has evolved, and we've learned that certain practices have been enhanced, and some other practices are not as healthy. So, and I see some hands. I'm gonna take those. I just want to give you one quick example. For instance, there was a time when we were doing where the treatment model, substance use treatment modality, was really about was the TC approach, therapeutic community. What we learned a lot about that time before trauma-informed care came on the scene, or because trauma-informed care came on the scene, is that a lot of different practices in that modality was more confrontational, more traumatizing for individuals. And so we don't endorse that anymore, because it's not effective. And so new research and new practices have been shown to be the ones that most of your funders want you to engage in. Jacqueline, hi, what would you like to add?
Yeah, just having an objective treatment plan that the client has also contributed to, so that we know the goals, the objectives, it's evidence-based. And then we have something to measure their goals and how they're doing, working towards their plan. And then, of course, you would have supervision to monitor what you're doing.
Yeah, it sounds like you're speaking to like the 12 core functions for CASACs in New York State. And so there are certain protocols that we learned that is appropriate that we need to engage in when we interact with folks. Thank you for that. Cassandra, what would you like to add?
I was just going to say one of the most important things I've learned is just practice within my knowledge, skills, and abilities. And also when working with the client, asking their permission. Sometimes just simply asking their permission because there may be situations that we may not have knowledge of that may put a client in more harm than not. And also working with the interdisciplinary team to different professionals' opinions of those things.
Sounds like a checks and balances thing. And I like that. Good way to practice objectivity. Hi, Antonio. What would you like to add?
In my opinion, I believe that this industry continues to evolve. So one thing I can check my motives and always sharpen my skills is by being open-minded, attend trainings, because I may know some things and I may forget, right? Or I may disregard them because I think I have that down pat. Right? So I have to always sharpen my skills by coming to trainings like this. And that's why it's required by my agency for me to continuously meet these requirements on a yearly basis. So I'll know what course of action to take when I'm dealing with my clients that walk through my agency.
Thank you, Antonio. And I think that also leads to the next one, which is speaking to what everybody said and what you just said. Because I'm also thinking, I always say some folks who are familiar with me when I do my trauma-informed trainings, I always say it's ethical, your ethical responsibility is to take care of yourself. So think about how your objectivity is more likely to be at its best when you are feeling your best, when you are doing well, when you take care of you. And so the person who's very tired, who hasn't slept, who's taking care of baby, or people sick at home, or who's going through some challenging health issues may not be as objective. So all of those dynamics, and I like that actually Cassandra and Antonio mentioned, being able to go to different opportunities. Conferences do that, trainings do that, even sometimes staff meetings who do that, where you bounce information on here of different perspectives that you can incorporate and kind of understand where you're at in terms of your own objectivity. And so principle number 2 is also somewhat affected by principle number 1, which is must not discriminate in work-related activities based on race, religion, age, gender, disability, ethnicity, national origins, sexual orientation, economic condition, or any other basis prescribed by the law. And so this is definitely talking about things like implicit bias. And sometimes when we work in the field so long and we are so, we're so used to being effective with different people and get used to certain things. Sometimes, and they're used to using certain approaches and providing services in a particular way, we may not be as aware that some of the things we say might be biased, might be stigmatic, or maybe some of the activities that we do or we do differently between clients might be reflecting some kind of bias on our part. So our own awareness, and that's on you. That is on you. It's up to each and every single one of us to take a step back every once in a while and check ourselves in terms of, and I'm not saying of motives, because you folks are not in this business to hurt people. You're in the business to help people. But the idea is here that sometimes we don't hear ourselves. Sometimes something might be influencing us, and we might be biased for unwittingly biased. And so whether it comes out in our terminology or comes out in the things we do or don't do, we're going to talk about that a little bit more. But not discriminating or not thinking we're discriminating, having some kind of check and balance approach to be able to go back to your objectivity, to understand, are you doing what's best for the person? You know, can you get feedback from other folks? Do you hear things in conferences and webinars and trainings that you go through and stuff, and other resources that can be supportive in that way? And so two more principles tend to come up. Two more principles: veracity, which is the principle of being honest and truthful in all interactions with clients. And you might think this is a no-brainer, but it's not necessarily so. I remember one individual one time telling me in one training that if they have to lie to someone who's very upset and emotional at the time, and lie to them so to get them calmed down, that's what they're going to do. Now, that brings up an ethical question. Is that okay to do or not okay to do? Now, the dynamics of that situation or the reasons why the individual was saying that may be very specific, but this is where veracity comes in. Are we doing harm by being untruthful with someone and later on have to tell them the truth and then cause harm or re-traumatize? Or because one of the things that we do as addiction counselors is we're supposed to be mimicking the very behavior that they can emulate, that they can incorporate for themselves. And so part of that, you know, so they can navigate the world on their own at some point. And so being honest and truthful in all interaction with clients, it's one of the other ethical principles. Also, affiliation, building and maintaining positive collaborative relationships with clients and other professionals. And so,
oops, sorry.
I heard that breath. Okay, so a relationship with a client has to be, it's vital that you have a therapeutic alliance because that has to do with successful outcomes for that client. It's how that relationship can evolve. It's collaborative because person-centered care is about a collaboration. It's about understanding what their perspectives are, what they need to, what they want to address, and how you can incorporate and tap into their strengths to help them do that. So it's both of you. And that relationship, and sometimes those connections evolve with some comfortability over time. We want to make sure that those relationships stay within the parameters of our work. And so the affiliation of veracity is other aspects of that. Principle 3, must respect the integrity and protect the welfare of the person or the group for whom the counselor is working for. And so the whole thing here is like, can we focus on the client's best interest? Can we be collaborative? Can we keep our commitments? Can we keep our promises when we say we're going to do certain things? If we don't, do we have a respectful way of explaining how sometimes things don't happen? How something that you have promised for somebody, what may have happened? Because then you have the opportunity for them to learn how to problem solve. But really about making sure that if we make commitments that we follow through on them. Principle 4, must embrace as a primary obligation the duty for protecting the privacy of patients and must not disclose confidential information or records under their control in strict accordance with federal and state and local laws. And this is all about you doing or us doing our due diligence. You know, it's the idea that the confidentiality of the person, that's what part of the reason why we explained that early on. When we meet someone, we explain confidentiality, and we want to ensure that they are clear on what that means. I had a coworker, one of my past career moves, who would go through explain the confidentiality piece very, very briefly, where if the person already understood what confidentiality meant when they were in a hospital or another agency, then the counsel would sign off as the client knows. Not everybody understands, not everybody has the exact same set of confidentiality laws or rules that applies to their setting or according to their agency. And it would help us. It would be ethically appropriate for us to ensure that the client is clear on what that means. And so we've had instances over the years, and that's why these laws have gotten very strict. We've had incidents over the years where the confidentiality piece was compromised. Now, so let me bring up something, and this is for folks who may have been here for a minute. So, does everyone here, or who here understands and has used a fax machine before? Okay. All right. So fax machine used to be, thank you. So not everybody knows what a fax machine is. I find it so interesting that there are certain resources that still ask you for not just your telephone number, but your fax machine number. It's like, oh, okay, like we still use that. Well, doing direct services, I would tell you that there was a time, like for instance, where I would have clients, but they had an HIV status. And sometimes I had to share information with other resources. The most uncomfortable I ever was when I had to fax someone's status to someone else. Like, how do I know for sure that the other person who is supposed to receive it is going to be standing there by the machine? How do I make sure that I don't leave that document laying around because I got a call and then I have to come back? So these are things, yeah, medical providers still use it. So here's the idea. So that's just an example. The whole thing here is about doing our due diligence to protect the information, but protect the privacy of the client. And only certain people are supposed to have information if the appropriate release forms are signed. And that's the first thing that comes up for me was the fax machine. And so, yeah. And so I like that, Doreen. So it's best to send an encrypted email. And it's interesting because there are times where I've gotten emails because I'm in contact with quite a few of you folks. And I've gotten emails that were accidentally sent to me. Now, if I know your name and I know what you do, so what I tend to do, this is just what I do. I don't know what you would do, but what I do is I don't open it. I forward it back to the person. I let them know, listen, I got this. I don't think you meant it for me. Let me know if I should look at it. And I give it right back. Because see, that's my ethical responsibility, even though I'm not doing direct services. Because see, I can't unknow what I already know. I am not supposed to have any kind of medical information, any kind of personal information on any client. And so, and that happens once in a while. So the whole idea is I do my due diligence to not open that up because it doesn't refer to me. And so, and that happens sometimes with each other in the same setting. And so what do we do with it? It's what this is about. Okay. Any other ways that you protect privacy and confidentiality of your client's information? What are a couple of other examples? Especially today, day of age of technology and all that. Shamika?
Well, make sure you don't have like your computer open and everything's password protected. You're not leaving information out, sharing passwords. Yeah.
Very good. Thank you. And even though that seems like a no-brainer.
Yeah.
Yeah.
And certain things you can't put in there too, just because you have their telephone number don't mean you can just be texting folks left and right.
That's right. And then imagine, so that could be a challenge. Say when you don't have your own office, or maybe your office is shared with 2 or 3 other individuals. And keeping that monitor open on a client's account, like on their progress note on their page. Because not everything is just in a folder. Back in my day, we had binders. I don't know if you folks still have that, but we had binders.
I know them days.
Oh, yeah.
I remember them days, pen and paper, hieroglyphics, cursive writing.
Hieroglyphics, thank you. Cassandra, what would you like to add?
I was just going to say, anytime I leave my office, even if it's to go to the restroom or something, I always lock my door and I lock my file drawer because I want to make sure that my documents are protected. Because, management or IT might have a key. However, there's no telling who may have access to other things as well.
Thank you, Cassandra. Great suggestion. Thanks. That's a nice approach. Kyron, what would you like to add?
Releases. I think that assuring that releases are signed effective, properly, and that they even have them. So releases is another way to protect the client.
Okay, yeah, release forms are the only ways that we really should be sharing information with anybody. If they're not in place, we shouldn't be sharing them. And just because you made me think of this, Kyra, is that when we do these release forms and we ask folks to sign them, we are clear. It's like confidentiality. We want to make sure that we're clear that they understand what that's for. And what would be who is it for? What's the purpose? And only if they're open to signing that form. Not that, here, you have to sign this. Let me explain to them what it is, and they make the informed choice that I have to follow. Okay, so, because it gets a little tricky. So, we could be very general with this, but then when we get very detailed, it can go all kinds of ways. So thank you for that. At our organization, we use MR numbers when relaying client information. Okay, yeah, and we used to have those unique identifiers too, and not have any kind of name outside of binder. Back in the day, in my time, when we would have an audit and we were pretty much on lockdown, the whole darn agency, had to go through every single folder and make sure that it's all appropriate. Sometimes there were forms, not just forms missing, but actually forms were were outside where they were more obvious, where you could see the name and some personal information. And that should never be. And so in an electronic file, it's a lot easier. So EHRs, the medical community tends to use that, electronic health records, has the opportunity to also have some safeguards. And yet, like Cassandra said, it said still, that computer, and Jamaica said, computer has either the monitor has to be gone or that you have to be off that person's account. It's just the idea that anybody can walk by and see something. So thank you for that. Okay. So I'm going to do this as more of a large group than a small group. So I want to ask you all a question. So I'm not going to do this as a small group because I don't want to go through the technology headache, and I don't want to put you all through it since it was a challenge this morning. So in terms of self-disclosure, these are the 3 questions. Why would it be appropriate at times to self-disclose with a client, and why? Why? And then if it's not appropriate to self-disclose to a client, why not? What are some considerations regarding when and where you might consider self-disclosing? So first question, when is it appropriate and why? Erin.
When it benefits the client.
Okay. So if it's going to be for the benefit of the client, it may help. You may want to do that. You might consider doing that. That's right. And
right.
See, so thank you, Erin, for that. Because one of the things that always comes up is, and we don't always think about, and I remember when I first got into the field, I wasn't always told. I was told about the benefit, the motive, the motive that drives us to do certain things, to interact certain ways, to provide certain types of support is part of why it's okay to do certain things or why it's not okay to do certain things. So motives as incentives, the goal is really key here. Antonio, what would you like to add?
Well, I heard you say self-disclosure, right?
Yeah.
But
yeah. Is it appropriate or not appropriate, and why?
Well, not so much is it appropriate or why is it appropriate. Who's it disclosure for? Is it for me or is it for the client? That's what I'm more concerned about. Am I disclosing because I want to let the client know a little something about me, or am I disclosing because I'm trying to support the client in that aspect? So that question has a lot of pieces to that puzzle.
Yes, it does. Thank you, Erin. Erin, you are actually speaking to the same thing that Erin was saying. What would it benefit the person, not us? Thank you for that. Jamaica, did you want to add?
Yeah, I was thinking more like countertransference, but I think she kind of hit on it too, because that's essentially sometimes it is when we do disclose certain information and kind of being aware of that and those boundaries and what we're sharing. Because even when you do share, I mean, it still is limited, but it's also used sometimes in order to validate and normalize certain behaviors and understand. You're not trying to say that you co-signing or 10 toes, standing on business with them, but at least to know that, hey, you're not the only one. So I think to me that goes back to a little bit of person-centered too. But once again, making sure you're not dealing with your countertransference and little biases and things like that, that you kind of address some of those also before you start. Because if not, you're going to end up, in the session with them. Now you need to call somebody.
Thank you for mentioning that. So see, the countertransference makes me think about that first principle that we talked about in terms of objectivity and integrity. And how do we work with that? Sometimes the person themselves can't see it. So had a situation.
I have a T-shirt that said, "This is not countertransference. I just don't like you." So that's my clarification to me. But I mean, you really think about that, because we do have also a lot of vicarious trauma that we may not even be aware of too, because of the stories that we're listening to and things like that. And sometimes becoming desensitized. So are you really doing the work for yourself too at the same time? So
this is true. I had a coworker one time where I was working with a client who she was a victim of partner violence, and she was actively in that relationship. It happens to that her partner was also in the program, and we learned about the partner violence issue. Now, I provide the services and the support that I can and work with what she chooses to do. At one point, and this was a person that was recently hired, she was working with him and the battlers, quote unquote. And so one day when she found out about it, what she did is she made sure my client left the setting, and she intentionally held the batterer there for a certain amount of time so she can leave. Here's the thing. First of all, I got upset. It was like, if you're going to do anything with my clients, that's why we got case conferencing for. That's why we've talked to each other as colleagues. So that wasn't done. That was one part. The other thing was, and I think more importantly, was her risk, putting her at risk because she's doing that. So what we realized that there was some kind of transference stuff going on with the person because she has some unresolved issues. Apparently she thought she did resolve issues, but she did not see that she was doing that it was happening at the moment that it was happening. The good thing is that the rest of us saw something. Her supervisor, me as the colleague, because the young woman I was working with eventually, she gave me a ring that afternoon. I had no idea that all this happened until she called me. She called me at the office. And so sometimes it happens and they're not necessarily aware. So that is a really good time for supervision to step in and come in and, okay, let's talk about what's going on with you. And so she ended up getting the support she needed. She didn't lose her job, but she did end up getting the support she needed. And she was put on a certain, I think, 90-day probation because the risk to the client, So the supervisors were all able to work that out. But yeah, because stuff can happen. Sometimes we even think we have resolved some issues, and we may be in the moment caught up and not see that our stuff can come out and harm someone else. And I know that's an extreme example, but it was a real example, So thank you for mentioning that, Jamika. Okay, so if it's appropriate, it's not appropriate, what are 3 considerations regarding self-disclosure? So that was the third question. Aaron and Antonio both spoke to who is it going to benefit? Is it going to benefit the person, or I'm trying to say, if there's a little bit of ego coming out and I need to tell you about me. If I can do this, I know you can't. No. We have a wonderful way of connecting with the client community, but the services are always focused. The motive is always about helping them. Would that help them? And self-disclosure is a pretty interesting topic to consider because today we have the peer recovery, the peer support specialists in New York State. It's peer professionals across the country who have augmented the work that we have done in these disciplines, have done a fantastic job to help organizations and services align and support people in need that much more specifically. Now, those folks would use their lived experiences. That is the core of the work that they do. Addiction counselors don't necessarily have to do that, but they just know who you're doing it for what reason. The other thing I'm going to mention, because from everything that was said also, is that if I'm going to say something about me, Just remember that once I say it, I can't take it back. So do you really want to make sure you share it from your perspective, from your personal perspective? Sometimes a third person perspective might be helpful. But think about that. Once it's out there, it's out there. Okay? You can't take it's kind of like the World Wide Web. Like once it's out, you can't take it back. The thing is, you know, what we say, how we say it, even for what purposes that we're saying something for, if we want to initiate or want to, you know, make a connection with an individual, or we want to inspire hope in some kind of way, we want to make sure it doesn't come back and bite us. Because it's not just us, it's our organization. And you don't want that to be misconstrued. So some things to keep in mind. Okay. And so any other consideration, one must be mindful of all parties involved. Okay, so let's see, Nanette says if the client asks a direct personal question, explore why they are asking first, discuss the reason, mess around their reasons before deciding to disclose. That's a good approach, very good. So any other suggestions that we need to, any other considerations that you want to suggest? Hi, Robert, come on.
Yeah. Hi, I haven't been contributing very much,
Yeah.
and I apologize for that.
No.
My thought was I try to avoid self-disclosure. And the way I do it is by saying, I have a family member who experienced that, or I have a friend who told me about a similar situation. And the friend is me, but nonetheless, I don't say that. What do you think of that?
That's a third person perspective. I think that's very cool because no liability issues behind that, but you are making a reference that can be inspiring, can be helpful, and it also, of course, depends on the context.
Right.
Yeah. Thank you so much. Kyron?
I was just gonna say, I'm just like the gentleman who just spoke. I really don't use it very, very often. But if there's a skill where if you do absolutely feel it's a benefit of the patient or client, that you always put it back on them. You never leave it open on you. So you would do the disclose and you would kind of like put it back on them. How does this relate to your life? Or what does this mean? You know, you never leave it on you, if that makes any sense.
That makes perfect sense. Thank you. It's kind of making sure that where the point and the focus is supposed to be and the goal of why you even brought it up. Thank you. Hi, Antonio.
I like what the gentleman previously, before the other gentleman said. I'm in total agreement with that third person approach, but also as your skillful helper or your clinician or counselor, my job is to set a code of ethics, right? So I'm also having the ability to start this conversation off the right way. So I have to be very mindful of that, right, with my approach when I'm dealing with you. I deal with a lot of drug court people that come in that are mandated. So their whole objective is to try to find an angle. Right? Now, you talked about peer support, right? That's what those people are in my agency for. If you need that support, I can refer you to that person. Oh, you want to see Diana? She's right down the hall. Hey, Diana, hi, this is yada, yada, yada. You know, because I leave my personal life in the car. I can't keep disclosing about what worked for me. And I'm just giving an example, because if I keep talking about what works for me, I forget about what's going to work for you.
Very good. Let's see. Okay. Thank you so much for that. And so that's going to bring up this slide, which is really, really good dialogue. I love this. Thank you. So in the therapeutic environment, self-disclosure tends to be a way to connect with the individual. So it's an intentional strategy to develop trust. I understand that. Just know that that some people are very comfortable doing that. I had a colleague, I'm going to say, geez, it's about more than 20 years ago. He in this agency, they used to have volunteers at the time, not peers. And eventually he came up through the ranks. He went to got educated, became a therapist, and he had always disclosed about him being in recovery from substance use. And so that worked for him. And he did it in a way to connect with the people he was providing services to. And I knew other people who were also in recovery, but did not disclose. It really depends on you and your approach. And so But a lot of time, but most times it's really about trying to connect with the person. So it can be considered a boundary issue between a counselor and a client. Why would that be? Why do you think that is?
The client might use it against you at any time.
Could be. So boundary crossings, just it could be, but if you tell something like that to someone, again, we can't take it back. You got to make sure that you're comfortable that the whole agency and anybody knows if it's that intimate, that personal. And so, but boundary crossings, just to be really clear, you know, it's really supposed to. Boundary crossings are not necessarily very concrete. They can be very elusive, and so it's like sharing maybe too much personal information. For instance, yeah. So what if somebody can use against you the fact that they went into a counseling session with you, and the session, instead of being about what they thought it was supposed to be about, it ended up being about you dumping about the challenge you just went through with your family. And you took up their time, and you got very, you know, and you felt so comfortable with them that you started to share with them about the situations going on with you. Yeah, somebody can use that against you. For instance, that they could say, listen, this person doesn't seem to be healthy enough to work with me, you know? The other thing is, if you're sharing your personal issues, it's not about that person anymore. It's only about you. So again, it goes back to motives. It's like, is it about you trying to connect with them? Is it a benefit to them? Or is it at that moment you're taking over, it's for you? So that can be a boundary crossing. Jamika, what were you going to add? I saw your hand up.
I think you kind of hit on it. I was reading what Natalie had wrote over there saying it blurs the professional relationship. And I'm at the same time, I would think like, you know, are you even healthy enough to help me? I mean, if I was the other person. And then I'm also looking at what is your awareness of your biases. Well, yeah. So
Yeah,
I need to, yeah. And I just don't, I mean, you know, we all have our schemas, our frameworks, and those things that we had, I mean, as a part of growing up. And so naturally on the other end, if I was looking like that, I'm like, man, you need some help too. Who you seeing? You know, so.
Exactly. So well, I always, you know, all conversations end up including some small portion about the importance of our objectivity, the importance of us caring for ourselves, the importance of us having our own people to go to. Therapists or psychologists have to kind of debrief with other therapists and other psychologists. While it's not specifically set for addiction counseling, but addiction counselors too. You know, people who supervise other people, them too, because we take in a lot. We've taken a lot from the client community. We've taken a lot with each other. We've taken a lot from the people who supervise. Hey, we have to debrief too. If we don't do that, just as a practice, just as a standard of healthy practice for ourselves as individual professionals in terms of our development in our effective ways of connecting with the client communities, then we can grow into a position where actually we can cause more harm than good. And we don't see ourselves, we don't hear ourselves. Antonio, what would you like to add?
I love it. I love it. I love it. We are the shock absorbers of this community. We have to be mindful of what we take on and the roles that we are set in place to, you know, uphold. But also in the process too, I leave myself in the car. I don't bring myself to work. I can't do it. Right. And then I come from a group of men and women that give me so much support and encouragement that it helps me because I can't transmit something I don't have. Right. And if I don't have it, I'm not being the best version of myself. I can't give my client the best version of me. So that's why I'm mindful of that. Self-care is important in this aspect of what we're talking about.
Yeah, thank you, Antonio. Thank you so much. And Jacqueline, thank you. Yeah, yes, that's what you were going to say. Good. Yeah, it's first of all, we are important. We're important. We need to take care of ourselves. We need to take care of our objectivity. And heck, you do a heavy job. That is not the easiest thing that you folks do. You're multitasking consistently while you're absorbing. I like what Antonio said, shock absorbers. And we are absorbing a lot from what you get from the client community. And it's so interesting how we are so good at putting out and helping others and giving that energy and focusing over outside of us. And that every once in a while we forget that we have to get that to ourselves as well. We forget. And so we shouldn't have to be reminded in case when someone has a challenge with us or someone has a problem with us. And then we find out, oh, this is how we've been doing. Our own self-awareness, I think, is part of our ethical responsibility in terms of our objectivity and stuff, in terms of self-care, in terms of if we're really trying to focus on providing the best services possible and individualized services, according to need, then we have to take care of ourselves as well. It also kind of diminishes our credibility when we are not practicing what we preach, because we're preaching all this and supporting our clients with all these different ideals and these practices, and we're not practicing them. And so that puts us at risk. Inevitable disclosures. So that was really good. First of all, your professional background is something that you might have to disclose if someone asks you. It may be noted in the HR office. Yet with your clients ask, what are your credentials, what's your experience, what approaches you're using. If they're at a point where they want to ask, we have to respond and be transparent. We could talk about our experience in the fields, our inevitable disclosures. A lot of times it can come out as part of the conversation. Training and education and credentials. The therapeutic orientation is also part of the approach that we use. These are different disclosures that are likely to come out, not just at the human resources level, not just when they're hiring you, but even when folks are trying to work with you. Imagine somebody some folks who are working with youth, and a family comes in and they are very mindful, like they want to make sure that their son or daughter or whoever the kids are getting the best support possible. And so they can ask you about your expertise, what's your experience. If say their child identifies as gay, what's your experience with that? Have you been able to help other folks with some gender issues with some folks? I say that because I do know someone. I remember I was doing the 350-hour class in New York State that's required to be a case act and eventually a case act. And I remember this really nice individual. He was really kind of humble kind of person, very quiet, but very, very smart. And so when he spoke, he was very accurate with the information. And yet he did say one thing. He says he's a family therapist. He can work with the communities. What he couldn't work with were with the LGBTQ community. Now, he was very clear, and he was transparent. And he said it's something he's working on, but at the moment, he did not want to cause more harm than good. So I thought big respect for that. It's like he was working on it, especially. That part is the part I like, is that not just like, okay, I can work with them and that's it, I'm just not working with them. So, these disclosures can be so helpful, especially when we are matching different client members to different professionals. And so we have a lot that we've already digested here. And I'm looking at the time. Let me come out of here for a moment. I love having conversations with you folks. And so, but I have a feeling that this is a good time. I didn't tell you we were going to have a break, but of course, for a 3-hour training, I'm definitely going to give you a break. How do you folks feel about taking 15 minutes right now?
Sounds good.
Okay.
Sounds good.
Don't log off. All right. Just you can turn off your camera if you like, and we'll come back. 15 minutes. Thanks. So the conversation is going really well. Thank you so much for what you're adding. We could do this for days because there are so many different experiences you folks have had, and so many different opportunities to kind of question, okay, what is the right next move here? So that's what I like about these ethics training. So I do have more content that we probably have time to cover. So what I'm going to do is, some of it I'll go to really brief. Just going to kind of read through, but this next portion is really important. And you'll see why. So let me put it like this. So going through the 20 principles of the canon of ethics according to New York State. So number 5 is must not engage in relationships with patients, former patients, or their significant others in which there's a risk of exploitation and harm to the patient. And so we already No, it's not something that we don't see, unfortunately. Must not engage in any sexual activity with current or former patients or their significant others. Must not knowingly engage in behavior that is harassing or demeaning, including but not limited to sexual harassment. Oh, by the way, thank you, everybody. Kate just reminded me. Please re-sign, put your full name in the chat box again, please. Just to make sure that we can tell later on that you're here. Now, this is a no-brainer, but I don't want to make assumptions, right? So we must not engage in relationships with persons that we provide services to or their family members or significant others, and risk of not just sexual activity, but we also don't want those dual relationships that can exploit and potentially harm the individual, whether it's a short-term or long-term. Why are we doing that? What is the one specific and easy reason why we don't do this? Cassandra?
One of the main things is you could harm your clients. You get into a personal relationship with your clients, and that'll definitely harm them, especially if the relationship ends and then the client becomes, whatever happened beginning, it may be returning to substance use, it may be severe depression or anxiety, any of those things.
Very good, thank you. Jamaica?
There's a power dynamic there. So
Yeah.
I mean, they're subordinates, and you're doing those things too. So I mean, that's one of my main things when I think about it too.
Okay, thanks, Jamaica. Dante, what would you like to add?
Other clients might think that you're getting too close with the client. It's like you're doing something for that client, but not for the other client, and like they might see it. I don't know if I
Okay.
explained that correctly. I think I did.
No, I think I know what you're saying. So you don't want to get in a relationship or any kind of relationship that exploits with one client because the other clients might see it and it might have an effect on them.
Yeah, correct.
Okay, and that's going to come up. I'm thinking of that more in paternalism, but that's going to come up. Thanks, Jadina.
I think it's a dual relationship issue too, right? So, you're breaking that confidence in a way, because if your client's coming in and they want to talk about their relationship with, their sister-in-law, and then you're in a relationship with someone related to that, it just becomes very complicated, and it kind of makes you biased towards information that client might have to come in to share. So it's complicated, makes it more complicated.
Okay, we'll make things more complicated. Okay. Somebody said something? I'm sorry. Okay. All right. Thank you, Jadina. Let me see if I could frame this correctly. As an addiction counselor, when we're working with the client community, we're talking about people whose mindset is, the chemicals, just rewire the brain. The cognitive process, their capacity, it's not that they can self-determine, and yet there are a lot of concepts that can be confused. And it's not a depend question, but it's really about understanding that this is a very vulnerable population. We always use that word. This is part of the reason we're here to help them, not take advantage of them, and which is really what we will be doing. So if you were to say it's a sexual relationship or a romantic relationship, if you engage with another individual outside of the client community in your personal growth, it's one person with another person. But when you're doing that, when you do that with someone who's vulnerable, whether it's a sexual or romantic relationship, or there's another kind of relationship maybe, or their family has a barbershop or a styling place, and we want discounts, it's exploiting. So really what we're doing is taking advantage of the individual. The person is not in a place to necessarily discern between what's healthy, what's not healthy, and may not have been, and may still be in that part of their earlier recovery or even later recovery, even 2 or 3 years in. They're there for services and not to be put in a position where romance can be part of the process. It takes advantage of them. The power dynamics that Jamaica spoke about before, that plays a big part in this. Not to mention what it says about you. Antonio?
I would have to unpack that even further. I like what you said, but also I'm dealing with a community of people that are emotionally raw, right? They're vulnerable, you know. So what do I look like doing that? And at the same time, where's the power balance in me? And do I miss my primary purpose and focus of what my job entitles me to do on a regular basis?
Yeah, yeah. It kind of really, and yeah, and further, you know, it really intersects with all the other comments that we have already brought, and the scenarios that we brought up before, the power dynamics and the vulnerability of the person is my biggest issue, because it takes time for an individual to find, you know, to relearn how to process information, how to understand, you know, how to make healthy decisions for themselves, how not to confuse what a romantic relationship is, what a helping relationship is, when somebody's trying to be friendly and just helping you, as opposed to someone who might actually want to take advantage. Okay, let me stop saying take advantage. Someone who wants to get in a romantic relationship with you when they're supposed to be in a position of helping, you know. So it is not a good idea. It actually can. Here, what's the principle that comes up? Remember, we went through the principles. Which is the principle that comes up if we get involved in relationships, low relationships that exploit or sexually, you know, take advantage of someone?
Do no harm.
Okay, what's that, Sania? Stania?
Ethics, yes. Ethics.
It is ethic, but which one?
Oh.
Do no harm.
Do no harm.
Do no harm. So typically, if we get into a relationship or some kind of understanding with some kind of connection with someone outside of our work for a particular service, for a particular reason, there are two people that can make active choices, healthy choices for themselves, what they want to do. When you are there with the head of a provider, you are there for their well-being. Nowhere does that include your needs. And that is so, that doesn't even have to do anything with ethics. It's just something you don't do. Why would you take somebody who needs your help?
Right.
Yeah, so non-male ethics is about to do no harm. It could be really they have
Do
these
no harm.
situations. Okay, hold on a second. There's a lot of different mics open. There have been situations where folks, and sometimes in work, sometimes outside of our discipline, where folks have confused the friendliness of people in helping them and have gone through traumatic processing just to come to terms with it. Some folks have been reactive. Some folks have hurt themselves. Some folks didn't want to live anymore. So there's so many things that can happen, which we already know about. But yet we're there. But I really like what you all are saying about what capacity you serve. You're supposed to be helping the other person. So their vulnerability is always at risk. You are entrusted to take care of their welfare, for their well-being. You're entrusted to take care of them. You're entrusted to protect them. It's not just their information that needs to be confidential. It is their well-being that is in your hands to a certain extent, at least within the capacity that you're serving. And so you're there for a particular purpose. You're not included in that purpose. just that simple. Now, just to be fair, say it's not a sexual relationship, but say you're in rural area, and so rural New York State, rural Ohio, rural Tennessee, you're in areas where it's a small town, and people you provide services to, hey, you probably know generations of their family, they probably know generations of yours. You got to take a car in somewhere. Guess what? The local mechanic shop, guess what? One of your clients is working there. Might be a client on your case. So guess what? It's not an intentional dual relationship you're getting into, but you got to get your car repaired. So how you behave, you know, it still makes a difference. So one of the things we are expected to do is still have the provider hat even outside of the job when we are even interacting with some of these clients in our communities. So it's never a very straightforward question, but it is something that is always by looking at our motives. Why are we doing something? And then we taking the right protections, the appropriate protections for them, as well as for ourselves. Because things can look iffy and someone might say something, And the one thing you don't want is to give ammunition for that, especially if nothing's going on. So really kind of be mindful of our own mannerisms and our interactions, our wording, and what we do and don't do, even in that extent. And so the whole idea is that you have a vulnerable population, and it certainly will break down the therapeutic relationship, as was said. That's not a boundary crossing, that's a boundary violation. You know, it can increase suicidal risks. It can exacerbate depression and anxiety for people. And we can go on and on and on and on about that. So even if a person, so you folks can think about this, like if a person does kind of, you know, they feel comfortable with you. They're being very transparent with you. You know, they've been coming in for the last couple of months or 3 months or anything or something, and maybe they come on to you. So it's about what you do. They might feel love for you. I mean, when someone has been using substances for a length of time, and that brain is not working right, that brain's going to take some time with constant support to go to a place where they can make healthy choices, process information, get into healthy habits for themselves. And have these new experiences. So they can kind of deter between what's healthy for them, what's not healthy, and so much more. And meanwhile, you're probably the only person that has been so friendly, so helpful to them. What if they start feeling love for you? Or what they think is love? Or they might maybe see you as like they're a savior or like their parents. What do you do? What are your opportunities here? What do you do? Cassandra?
Sometimes I remind the client that they spoke about a close friend or family member who supported them and that encouraged them. That way it kind of turns it back on them. And also it helps them to realize, hey, I do have positive relationships in the community that they can depend on. That way, and just let them know that I am here for you. I can, I will help you along and as much as possible. However, I also understand that these are people that know them better than I ever could. So these are people that could really help them.
Nice approach. Thank you, Cassandra. Letting them know who are their resources, what's their recovery capital look like, who are people they can go to at different times. So that's a great that's one of many great approaches. What happens when the counselor is the one who's going through a tough time and the counselor kind of flirts? Maybe that's not really getting a romantic relationship, it's the flirting. So want to think about the times where a counselor themselves, we may be at the most risk, is thinking about when you're dealing with loss or low self-esteem, or maybe we're in recovery and we're dealing with certain challenges, or whatever it is, but sometimes we get put in vulnerable positions as well. What do we do with that? Erin?
I would say go to supervision like immediately and start talking about it and making a determination about maybe even transferring the case at some point if that can't be, remedied. But yeah, go to supervision right away.
That's kind of like the first thing that comes to mind to me too. Thank you for that. Clinical supervision is there for a reason. It's not just about liabilities. It is about your own wellness. So clinical supervision can be a healthy resource for us to help process maybe some of the feelings, maybe some of the perspectives, and helps kind of refocus us. Robert, did you want to add? Okay, so it can help us refocus. Guess what? In our humanness, because we're professionals, we probably should all have an S on our chest. You should all have that for Christmas. Everybody should get a t-shirt with an S on their chest because that's the kind of work you all do. In our humanness, while doing all that fantastic work, we go through things too. You talked about a personal situation with a person. You took that session to put part of you in it. That's not good. Even if you learn and you become aware of it after the fact, you can come back and still come back and reground yourself, because your own awareness is what's going to help you. You can't go to clinical supervision if you don't think there's anything to address. So your own awareness is part of your responsibility. And that's what they tell us. And that's still true. So sometimes our vulnerability puts us in a position where it might be a good idea I had a colleague one time that was kind of flirting. And, and remember, this is years and years ago, one of my past career moves, another past career move. And he asked me one time, he says, what do you think I should do? I know she's looking to like kind of get with me, and I'm kind of enjoying it. And he clearly states how much he loves his wife, and I knew them both. And he said, and I told him, I said, well, maybe it's not the question just of whether or not you should or shouldn't, but maybe the question is, why would you even consider it? It really is, we need to look at ourselves. But clinical supervision is a great resource. That's why clinical supervision is periodic. It's not just when you need to talk to somebody, you meet with the person periodically, because you want to check in with your staff. You want to check in with the community. One of the best things that organizations can do is to invest in the clinical supervision piece. Turnovers don't help your business. What helps your business is a healthy workforce. And clinical supervision is a key aspect of that. Hi, Antonio, go ahead. What do you want to add?
Also, too, what comes to mind is, let's say I get romantically involved with the client. I take advantage of their vulnerability. The client starts to figure out this recovery process. The client also figures out that I'm not really attractive anymore, and I'm not somebody that, that they see interest in. Matter of fact, I would like to get a different counselor.
That would say so much about your client. Means your client has grown a lot. And so, well, hopefully, and thank you for giving us an area, but hopefully we don't want to take it that far. It should not go nowhere near where now, like the person, like the counselor themselves is like feeling, like they're alone. Not for nothing. It does happen. I know. So I've had so many different experiences in direct services, and I've seen it happen. And it just says, are we? And this is why the organizations really take a lot of stock in New York State Oasis and other entities across the nation. Take a lot of effort to make sure that we familiarize ourselves with ethics, every few years when we have to be credentialed or renew, because we are working with a vulnerable possibility. Sometimes we don't always see that we're kind of swaying off the track, And so we could use that. We could use the help every once in a while. And so clinical supervision is great when it can check in. And sometimes there are times where, and it's happened, I'm not going to say any setting here, but there are times where clinical supervision is not really available in some settings. You make sure that you have someone that you can go to, that you can, as another professional, whether they're on site or outside the site, someone else where you can run, your challenges and your week through, that you can meet with periodically. You can take the responsibility on for yourself. If right now, say your organization is in between, supervision professionals at your setting. And it's just so important to, if we don't, I think I'd be concerned with the fact that I might not want to run anything by, because I don't ever want to be a provider that knows everything all the time, is always on point. It's no such thing. Imagine that. That's got to be a heck of an ego to really house. I'm just not big enough to house an ego that big. But I would tell you that the one who would be at risk is not just the other person, but myself as well. Because when we don't have that support, that stress, all that affects us physically, not just mentally. And mentally, we may not pick up on it until after we get some somatic kind of symptoms. So it can go in so many different ways. And so when it comes to vulnerable population, we don't want to take advantage of them. Let me go through here. Oh my goodness, I look at the time. I love having these conversations with y'all. Geez, I want to get through half this stuff. Principles 8 through 10 must not exploit patients or others for whom they have a position of authority. Okay, so you don't want to exploit clients. We don't want to borrow money. We don't want to finagle it in any kind of way that way. Must treat colleagues and other professionals with courtesy, respect, and fairness, and cooperate in order to serve the best interests of their patients or clients. And so we have one of the core functions is case conferencing with other professionals. So that's part of what we do. That is part of, like when Cassandra first mentioned it about, how that's a good way to kind of, work with our own objectivity. It's looking at situations from different ways, from different lenses, and what may be the best most appropriate, the most tailored way to meet the needs of any given person. Most notified appropriate authorities, including employers and OASIS, when they have knowledge of a colleague's impairment or misconduct. This is a tricky one because nobody wants to snitch. But if you find out that someone was doing something unethical and exploits a client, and it comes to light later on, and any one of us knew and didn't say anything, we can get in trouble too. So any kind of impairment or misconduct which interferes with treatment effectiveness and potential places the patients and others at risk. Cassandra.
I was just going to say that that's very important too, especially when or if you're in clinical supervision, if you're a supervisor or the supervisee, those things can still happen. So it's important to maybe have a mentor, mentee, or, get in, have supervision and just review ethics.
Mm-hmm. Yeah, and I think, and along with that, I speak a lot about opportunity for two things: introspection and interoception, which is one is looking at our value system and our belief system and how, and being aware of our own stuff, our own philosophy. So it's not part of how we get to know someone else. So it's not part of the filters that our lens and how we meet someone and see them, but also how we feel and all that. So we can better be in as much grounded of a place as we can be. So we have our own responsibility we can take, but we get caught up. And so I love the fact that when someone can remind me of the ethics, when somebody can kind of come up and every once in a while bring it up and say, these are, some things to keep in mind. These are some of the challenges we've been having as an organization, and some of the things to keep in mind is such and such. If you need support, we got you here. That's important to know that you have that kind of support. Let me go back. So let me go to principles 11 and 13. Expected to recognize effects of their own impairment. That's that self-awareness piece I'm speaking to. Must not provide services that create conflict of interest or impair work performance. So if your judgment is going to be at risk, if you're not going to be as objective, again, the objectivity it's intersecting a lot of these principles. If we're aware that we're more tired than usual, if we haven't taken vacation in a long time, if we know that even though we're going into work 9 to 5 and we're still taking work home and we're doing 10, 12 hours a day, and not for nothing, a lot of us do that because the field is that much more overwhelmed and that much more understaffed. And we cannot meet the demands, and yet we're taking on all this. And so you have to find yourself in there somewhere to take care of you. It kind of speaks to, if you care about other people, then you have to take care of you first. So must cooperate with investigations of proceeding and requirements. And there are times when the justice, the Justice Department there's a situation and there's some liability issues and colleagues with some other coworkers, and you might be called in to play a part in those legal proceedings. You have to be as transparent and under oath, and you have to do what you have. You have to share whatever it is that they ask you about that you know about. So must not participate in filing of ethics complaints that are frivolous or on purpose, just other than to protect the public. Financial practices should be in accord with professional standard and safeguard best interests of the patient, the counselor, the profession. Here's the thing: we can't borrow money from our clients. Okay, we can't ask favors because they own the local salon that we should get a discount. This is not. That's also that exploitation piece is also taking advantage of vulnerable community. Must take responsible steps to ensure that documentation record is accurate, sufficient. It's supposed to tell a story. It should be even simple grammar should be included, and in a way where it's feasible where anybody can look into that file if they have to cover for you, like if you're away or you move on to another position, and they should be able to just pick up where the story continues for any given client. So documentation should be done very quickly or as soon as possible after you meet with the person. That helps with your accuracy, and it shouldn't be like not too little, not too much. There's different principles that also guide documentation. A lot of times your grants, have a format that they require you to use. But even I do SOAP notes, like a subject. SOAP notes gives you a clear very simple format of subjectivity, objective, your professional assessment and what the next steps of the plan would be, but your notes have to be clear where anybody can pick up on it, an auditor can pick up on it, supervisor can pick up on it, another colleague can pick up on it and see, because they're going to cover for you, and they can see where a client's process is at and can pick up easily. Legal and accepted moral codes, which pertain to professional conduct. We are expected to adhere to that. That's not just part of the job that we do at an organization, it's part of the profession we step into. Must recognize the need for ongoing education. So that's what the renewal requirements for your credentials are really helpful, because they ask you to make sure that you get a certain amount of certain key topics under your belt, that you get trainings for that. And that way it keeps you abreast of how these things, intersect with the capacity you serve and how you engage clients. You have to acknowledge the limits of your present knowledge and public statements concerning alcoholism and substance abuse. It's still worded that way. If I were to, and that's exact, I don't want to compromise the writing that New York State OASIS uses. But I would say is in statements concerning alcohol and substance use disorders, alcohol and other substance use disorders. So you have to fairly and accurately provide information. Whatever you don't know, you can get from someone else, but you can't misinform folks. Again, that's the do no harm piece. Assign credit to all who have contributed to published material if you're part of a team or say a research project. And there's a publication that results from it. All participating parties are acknowledged in that. Strive to inform public of the effects of, again, alcohol and substance use related. How you can bring PDSAs, how you can inform the public, how you do health fairs, and stuff that can help the public understand about not just about how addiction can happen, but the fact that your organization is available to support. So the CASAC has to adopt a personal and professional stand which promotes the well-being of the recovery community. And so that means even when you leave that site, just like I said earlier with another scenario, you're always wearing the professional hat. Like there are times where we might find ourselves that we live in the community that we work in. And we might see some of the clients that, we might come across and bump into them, outside of working hours. Still expected to be the professional. So one of the things is mandated reporting, legally required to report suspicion of child abuse and neglect. This is often what we address during confidentiality also, because we also are able to tell folks, keep everything, we keep everything confidential here unless we have a release form, or if we know you're going to hurt yourself or hurt someone else, and then I am a mandated reporter, and I have to make sure I share that. And it's all about safety for you and the other person. So you do it as soon as possible, and you are immune from civil liability if you report. If you don't report, you can be charged with a misdemeanor. Now, I know I'm going through this briefly, but let me just go through a couple of these. I got a little bit of time. So I'm going to go through a few of these. I got more here than, but you will have these in your slides. So I'm going to ask you a series of questions. So you folks tell me how you feel about this. What constitutes a publication? Oh, so that's talking about, John, like for instance, sometimes you do some research projects. There might be pilot programs. There might be investigative projects. They're funded to learn about maybe how certain practices work, how certain don't. Then a paper is written and published, and it's peer reviewed, and then it's offered, to the general community, the science-based community. And so what happens with the publication is that everybody who is involved on that, and that starts to go in another direction, but everybody involved on that project has to have their names acknowledged, even if they weren't the one conducting this, the research project, even if they're not the clinician or the researcher or the scientist, their names need to be published as well. And so ethically, that's what you have to make sure you account for. So applying ethics in practice. A couple of questions for you folks. Question 1, I use my personal cell phone to speak with clients. What do you say? Always, sometimes, or never?
Never.
Okay, never. I see a lot of never. Oh, sometimes. Okay. Never. Never.
Never.
Okay. Many times. Go ahead, Sanya.
Yes.
Did I say that right?
Yes, Anya.
Okay.
Sometimes the job do offer cell phones, and you could use that to stay in contact with the patient or client.
So that's different because your job is giving you a cell phone, so you can't communicate because that's part of the job that you of the position that you have, the availability with some of your clients and that's or patients, and that is understandable. Personal cell phone, most people say never. Now, has there been times where certain programs have been limited in terms of funding and access to providers or counselors needed to be made available, and maybe they pay part of the personal cell phone bill? Not sure, but I know I've heard of some things like that. Luisa, what were you going to say?
Yes, at Catholic Charities, we used to have a treatment program. We've had clients who have graduated out of that program. One in particular was a woman who was in our residential program. When she left and then went into stabilized housing, she wanted to meet up. We went and had lunch together. I got permission from my supervisor, and she got my cell phone number. Now and again, she'll hit me up. She's moved out of the state. She'll send me a picture of a conference she's at or whatever. But she was the only one person out of several clients, the only one I ever gave my personal phone number to.
Okay. Thank you, Luisa. Sanya, did you want to add? Okay. All right, I saw you. All right, so know your agency policy. How's that for an answer? Know your agency policy. What did they say? Personally and professionally, I'm just gonna let you know, I've never given my cell phone to anyone. I can behave as a professional outside of working hours if I run into a client. It doesn't mean that I have to give them my personal cell phone, in case they have an emergency. That's why we have 988, 911. We have lots of other emergency phone calls, and sometimes organizations have that department built in that for emergencies that people can call into. So it's not a good idea. Cassandra, what did you want to add? I'm sorry.
I was just going to say that we do have mobile phones that we use for our job, but I only use my mobile phone during work hours, and I leave my work phone here at work because it is very important for me to integrate self-care when I leave the office. When I step out of this office and get to my car, it's important for me to just from there go and creating boundaries. Exactly. Yeah.
Very good. Okay, thank you. All right, so let me just move on to this one. How about this one? All right, so Crystal works for 988 and during our first breakout shared loads of insights with us. Very cool. Yeah, it's also part of healthy boundaries for yourself. It's not just for the agency, it's for yourself too. And also it also emulates a way of how to navigate through your community resources for clients to navigate through community resources to understand where they can connect to, how they can get help when you're not around and it's not working hours, so it's really helpful in a lot of different ways. So question 4, I recognize and understand that beliefs and concepts of emotional well-being vary significantly from culture to culture. Sure. Nice. Okay, I get a lot of always. That's good with that one. Okay, we're going to just leave that one there. Everybody's perspective. And I will just say something. The way we understand that, we don't assume it, but we certainly want to find out how does it vary? What are the beliefs and concepts of that person? Because we're going to approach them. Okay. All right, how about this one? It's okay to share with my clients my views and then no, let's just say not the November 2024 election. Let's just say this, share my political views. Always, sometimes, and never. Nope,
Never. You
never,
don't even
never.
want.
Never on
Never.
that
You don't
one.
even want to do that with your own people. Much less.
Yeah,
You better-
I agree with that. Not even with it, not even people I like. Or people I care about. Yeah, politics is something, especially these days. All right. Oh, that's interesting. Debating with yourself. Oh, that's right. That's enough of a stress. So your own political views. Okay. What tends to happen when it comes to politics, no matter what era, what time we're in, people can be very strong, have very strong perspectives about it. You know what can end up happening is that some folks can actually take your political view and use that for a reason for them not to engage with you, even though you're the ones giving them support. You know, you don't want to get that personal. It's a very tumultuous type of topic to get involved in. Not everybody can discuss it objectively, so better to stay away. Okay, how about this one? Oh, this is a good one. It's okay to receive a gift from a client as long as it's less than $20.
What?
Not an expensive gift, but maybe a gift less than 20 bucks. It finds its way into therapy. Okay. Nope. That was the political thing. All right. I had clients to give gifts to the team, but not to me directly. That's cool. Yeah. Sometimes can depend on the client's culture. That's a good point. So how would we address it? Let's get away from this for a moment. Let me stop the share. So how can we address it when someone, it's just culturally speaking, from their perspective, they want to give you a gift and appreciation, help them through a hard time. You know, you've told them that, you know, the agency policy is like, you don't take gifts, but, you know, it's part of their culture. How do we address that without pushing them away or offending them? Dante.
Oh, I was on mute. I would say maybe it's because like I know like some clients they might be sensitive and like they might like feel a type of way. So it's like you might take it, but then when they disappear, like later in the day when you're about to leave, give it to your boss, and tell them like, oh, the client gave me this and I don't want to take it. Yeah.
Well, I like the fact that shows transparency. You're letting the boss know and say, listen, this has happened. Like you're not keeping it a secret. So that's really a good thing. Okay. Louisa, what would you say?
Hi, I've had clients who in the residential program have made things, whether it be pieces of artwork or candles, and then give them to staff. So in that case, I didn't see it as problematic.
Okay. Give them to staff. That's a little different. Okay. Okay. Sanya, what would you like to add?
I would thank the client and said I would share it with the staff. It's beautiful, but I'm gonna share it with the staff so they can enjoy maybe the piece of artwork or something.
Okay. All right. Thank you. So, well, the places I worked in kind of used that approach. We didn't want to offend everybody. Sometimes, whether it's a home visit or somebody's just, it's the holidays, they give them a gift, you know. And one of the things that we try to be mindful of, I was like, I so appreciate this. I says, I am more than happy, you know, to help you get through your situations. I don't need a gift. I said, but I'm also not allowed to take the gift, but I really appreciate it. I mean, I think you work hard in your situation. I says, if you don't mind, I'm going to share it with everybody. Is that okay with you? I mean, I like to kind of let them know that I can't take it. It's appreciated, but I also don't want to push it back and say no and not offend them. I don't want to do that. So some of the things we used to do is like for instance, if you had to make home visits, if your program involved some kind of support, some board initiatives that needed to do home visits, how do you do that in with some cultural groups that when you go in, you know, they have a meal ready for you? How do you engage with them, not take the meal, or how do you work around that without offending them? What might you do there?
Well, I think kind of what Sonia was saying too. I mean, I don't think that I would be comfortable eating everyone's food, but I was just, like you said, thank you for the, but I can't accept this right now, or I'm not hungry or something. I don't like
Something
even
like
share
that.
it with my kid. I eat my own. I'm just particular. Yeah.
Yeah.
I don't. Yeah. I don't know. I don't know if it's. I don't know. Do you think also whether it's a northern or southern thing too, as far as people doing those things that may come? So I think I would also look at the belief system too behind that, where some people feel like
Yeah.
that this is something that they have to do. But I mean, still, once again, there's just certain boundaries because I worry about what would happen long term with that. So
No, it makes sense. This is a type of situation where the agency is likely to have some approaches and
yeah,
some ways around it, but also it's the fact that since we don't want to offend anybody, we can also there's some other workarounds. He says, you know what? I love the sign you said. I just say it. I said, you know what? I'm not ready to eat just yet, but if you wrap that up, I can take that with me. And, I said, I gotta tell you though, but I have to share it with other folks. Find what works, what your agency concept is about that, what is the protocol for it, and then find a way to do it, and to say it with transparency. Remember, we are supposed to use veracity. We want to tell the truth. We're going to say, I'm not supposed to be eating from anybody's food, but I understand you put all this work into it. If you don't mind, I can take it with me. I know that I can share it with a lot of staff because it won't be about us specifically. I mean, you have to find what works for you. Run it by your supervisors, run it by the decision makers in your organization, find what works. Most places that I worked in, we had 2-3 different ways on how to address it. It was always about keeping the person engaged, appreciating the efforts, right? Because a lot of times culturally, when you dismiss someone, dismiss the food, it can be harder to be able to engage them afterwards, so that's part of it. All right, so yeah, so it is about boundaries, but it's also about what approach you take and how to establish and reinforce those boundaries without losing the client. Okay, let me see what others. I let people know it is not okay to use racial and ethnic slurs or insensitive terms in front of me. Always, sometimes, never.
Oh, God.
I mean, I know how we're supposed to engage an individual. What if they're sharing their own thoughts with each other, whether it's residential, whether it's an outpatient program, whether it's a community initiative, Okay. That's good. Okay. So I got a lot of always, I am open and honest about that. Okay. Well, this is the opportunity, another opportunity rather, for you to show how you are for the people, that you are for helping folks where they're at. But then you have clients who might use racial slurs against each other, and they do that in front of you. Now, what do you do? Sometimes it makes for a good topic of discussion in a support group.
Can you repeat that again, please?
So what if a client is using racial and ethnic slurs, not against you or providers, but with other community members, with other cultures in the client community? What is our purpose? To help them get better? Does that include addressing their racial perspectives? Jamaica?
I'm getting tired of saying my name, but I mean, I worked in a prison for over 12 years, and even so I had to do it intermix with all of it. But at that same time, I look at this as an opportunity to re-educate, because my job is not to change your belief system. My job is not to get up here and do a debate with you, things like that. But it's still an opportunity to re-educate, to try to challenge your thought process, trying to reframe it in such a way that but then also setting, I don't want to hear that. Now, I mean, there's certain music, certain things, and certain things that we always kind of attribute as far as fundamental attributes that other people of a certain culture, all of us are the same certain way. But you can still have to set up those boundaries, especially for conversation and because you got other people listening too. And I don't want anyone to ever think that that's cool with me too. So.
Very good. I agree with you, and I agree with what folks are saying in the chat. See, the organization, all the agencies I ever worked for, even the ones I work for now, we have this approach where it's all inclusive, It's on keeping, and we try to behave that way. We also have an opportunity with clients when we're doing direct services to see, because part of what we're doing is helping them self-advocate and how to navigate through communities and resources and all that, and how some of the verbiage can be offensive to other people. And so how counterproductive that can be, not just for them to get their needs met, but just to get along with the community, to be able to live in the community. So you have an opportunity to address it. Is it part of your job? I think to a certain degree, it might be. But that's something that you really want to be clear on in what your agency says. So I like that sometimes helps me assess clients' frame of reference. Most programs have it in their orientation packet. Remind the client of this. It's nice to every once in a while reiterate the original do's and don'ts, the obligations and expectations of the program when the person first comes in that they tend to sign off on. And so that wouldn't be a bad thing to kind of reiterate that, but also find out where, if you have the opportunity and it affects their willingness to participate in other, accessing other resources that you might want for them, that you might be able to have for them to address some needs. If it gets in the way, this is something you may have to have a conversation about. Most programs have this in their orientation packet. It's important to establish healthy boundaries for all, including a level of respect and speech. All right, very good. Awesome. So let me just go through here. This is interesting, a very good conversation. And let me, okay. I have a little bit of time. So dual relationships. So a professional enters into a dual relationship when they assume a second role with the client. So again, there's a lot of depends in this, because if you're in a rural community where everybody knows each other, that might be a little tricky. If you are living in the same place where other community members that you're providing services to are, it's something that you have to think about. But the idea here, a dual relationship is not just having a sexual romantic relationship with someone. It is sometimes, or with the family members. It might be another way that you connect that's beyond your the professional role that you have in your job. And so, let me see, where did I do that? Okay, so dual relationships, they impair not just their objectivity, your objectivity, your ability to be able to discern between what's best for that person is just as important as them not being taken advantage of. It can be damaging to the worker relationship if some things kind of work out not the way either side expected it to. It can affect the therapeutic relationship you have with this person. You don't want to confuse roles of responsibility, and particularly with people with substance use disorders, some type of diagnosis of one of them. What can happen is there's a lot of confusion in terms of perspectives and responsibilities and capacities. And so they're vulnerable. That's not what we do. So it can limit our ability to be able to address certain situations with our clients if we have this dual relationship. Most agency policies will find that as a boundary violation. In some places, in some cases, it might be illegal. And so the idea here is, can we be friendly without being the person's friend? So our mannerisms is really about, we want to show that we care, we want to be friendly, and we want to be supportive. And it's different when you're doing that in the capacity of a professional relationship, as opposed to a friend relationship outside of the job. Those qualities might look very similar, but the context of the setting and the relationship itself is what helps define it. And so when we're friendly, just how friendly are we? It's like we want to be friendly because we want to engage folks. We're empathetic individuals, and we know that's part of how we connect with folks. But we also might have to be mindful that people in different places in their life, in their mindsets, or in their, say, their recovery process, can be very sensitive and misconstrue or misinterpret your kindness or your supportive ways as something more than just that. So what are some other unethical practices that you would say exist? Other unethical practices other than what we mentioned. Okay, criticizing, judging. Okay, Cassandra?
I think talking about your coworkers to clients or your colleagues to clients.
Gossiping. That is unethical. That is not a good idea. Yeah, thank you, Cassandra. What else? Borrowing money from a client.
Sure.
We know that this happened. Both of these have happened. Going back, I think faxing is really close to unethical for all the things you mentioned. Okay. Okay, nepotism. Anybody, Jamaica?
Being Instagram friends and TikToking together,
Ah,
Facebooking.
yeah. So it's interesting because I know that it can be a very small world. Think about it. You're on social media or whatever social media it is, and someone sees it. So they don't see it because they're your friend. Sometimes they'll see it because they're your friend or they ask you to friend them. If it's that social media or sometimes in Instagram. Also, it can be because they're friends with someone who you're friends with.
Yeah.
If we're not as proficient as we need to be, or at least as familiar with those features of social media, then we just know that we're taking a risk that whatever we put up there, whatever else somebody puts up there, may not even be us, but it'll come up in our feed, might provide an opportunity for client. Not a good idea. Cassandra, what would you like to add?
I was just going to say, Aaron had mentioned looking clients up on social media. I know that for our outreach team that we do look clients up sometimes on social media, especially if they're out of care with HIV and AIDS and things like that. However, I feel like it can certainly go too far as well. Like just, out there looking just to be looking. But we need to, I understand we need to do it to make sure that we can do our jobs, but not just to look, just to see what someone's doing and then talk about it.
Yeah, so okay, so I think it comes down, you're speaking more to like motives. Why would you do that? So if you lost a client to care and that's part of the agency practice, is one thing. If you're finding out looking for other information, what is the goal in that? What's the motive behind that? That makes me think of times when we have, okay, so when we see something on a feed, whatever social platform, or we see something outside of working hours, and then what the client tells us when they see us is different than what we see or we found out. What do? Ideally, you should work with what the client is telling you within the context of your job. Okay. All right. So we also talked about somebody said nepotism here. How do you stop from practicing nepotism? No, that's kind of an easy one. We said before about the principle of justice being fair and equitable according to the needs of the person. Anything outside of that can be a boundary crossing or a boundary violation. Overbilling a client. Oh yeah, that's now we're talking fraud. Okay, so kickbacks. That's fraud. And I cover a lot of that in the other training I do. Asking clients for cigarettes. So how do you feel about that? Or giving a client a cigarette, but asking clients for a cigarette. What is up with that? Not that it hasn't happened. Okay,
He said, what is up with that?
So yeah, I worked for a lot of years in the Bronx, okay? So don't blame me. I'm a Bronx girl at heart. So it's just so interesting that sometimes we get very comfortable. Sometimes we have clients for a long time, and sometimes it kind of gets grayed out, I guess, in our minds. But it's not, probably your agency has a protocol around it, but if not, ask, because it's not necessarily a good idea. Whether or not they have a habit of smoking, that's not me. But I'm in control of whether or not I'm going to share it. First of all, and I don't ever want to get that friendly. That, the boundaries start to fall by the wayside, and it can affect other areas of supports. What about this one? What about buying merchandise from a client, or somebody mentioned here, supporting your, what is it? Asking them to support your side hustle. So I remember we always had clients come around the holidays. They always did, they were selling different things to make extra money, and they would come to our organization. And yeah, you want to help, but you don't want to engage in certain practices. Just not a good idea. Not only does it lead to expectations, it blurs the lines of the relationship in terms of responsibility. The conflict of interest, yes, Erin, the conflict of interest that comes up is just kind of goes beyond, So then I had one more. I had one. We shouldn't be attending to anybody's children while the client runs for a quick errand. Has it happened? Yes. Should we be doing it? No. Okay, Louisa.
Hi, Diana. I'm sorry, I missed what you said about children.
Yeah, so another unethical practice is considered when a provider says, they'll stay with kids for a few minutes while they go get a box of cereal or a cigarette over here, or go run, make a phone call, tends to children while the client runs a quick errand.
I was going to ask, in the situation where you have a client whose kid is a Girl Scout, for instance, and so they ask if you're interested in buying Girl Scout cookies.
Mm-hmm.
If you were going to buy them anyway, would that still be considered unethical to buy them from a client's kids?
Okay. Before I say how I see it, does anybody else want to address Luisa's question? You like Girl Scout cookies, and her kids.
No.
Okay, so you understood the question. I don't have to explain it. No, why not?
Because it still has that, he favors me, she favors me.
Yeah.
Excellent.
Type of connotation. Yeah.
Man. And they're addictive too. Them Samoas. No, man.
So no, if you're gonna buy them anyway, you get it for someone else who's not your client. It's just that simple. Thank you, Kyron. All right, so I want to kind of just really finish off with this. I got a few things on telehealth and stuff, and that'll go on your slides, but I want to kind of come with this. And this is about, you tell me, why is it important for you folks to care about yourself? I mean, this really speaks to why I always tell you folks, this is your ethical responsibility. What can you do to take care of your own emotional, physical, mental, and spiritual well-being? Cassandra.
Have your own therapist.
That is a really good idea. Yeah, have your own professional resource that you can go to. Yeah.
And engage in social activities if you're a social person, if that's something that kind of gives you energy. Mine is going hiking. I love hiking. So that's just kind of my thing to get away. No phone, no anything. So.
Thank you, Cassandra. There is so much value in that loose term that most of us know as not retail therapy. I just saw it in the chat. That's not what we're talking about. So there is so much value when we talk about disconnecting. It's not just that we're in a technical world. That's not really it. What it is, that's part of it, but that's not it. It's the fact we get conditioned to doing the same thing every day, maybe very tailored to each and every different client, but every day we're going to work, every day we do this work, every week, every month, we get a break in between, we take a vacation, we keep doing this. We get conditioned. Our brains need to replenish. It's not just about objectivity, it's our own wellness. How can we care for people if we're not caring for ourselves? How much of our suggestions or our support will someone accept when we're in a bad place ourselves, and it can be evident. So when I was mentioning earlier about interoception and interoception, about being aware of ourselves, So, and I always use this example. It's like, it should not be that we look forward to a crash. We're so tired. We haven't slept in days. And when we crash, we know a crash is coming because the body can't hold it anymore. We shouldn't be looking forward to that. If that is something that happens commonly, it is time to take a couple of steps back and say, okay, this much of a load, what am I doing to counteract that? Where am I? So some of the things that Cassandra says, it's not just like, what do I do? I ask folks, has everybody here, let me just ask you, everybody here who's been in the field, whatever length of time you've been, do you still practice all of those? Do you still engage in all those personal hobbies and personal activities and do all those things that you used to love to do that spoke to who you were? Do you still, that you were practicing when you first got in the field, do you still do all those things today? Granted, you may have a family and that might not be the reason, but do you not do any of those things? One of the things, okay, so this is more rhetorical, but one of the reasons why I mentioned that is because a way for us to look at ourselves in as a transparent way as we possibly can is look at where we are when we started the field, when we started a career, and where we are today. What are the things that we love to do that we don't do anymore? What about, we used to train for marathons, or we used to go for community causes, whether it was Cancer Walk or the AIDS Walk or whatever, or we used to do a lot of artwork and now we don't do artwork. We used to love to read, part of book studies, book clubs, and now we don't do that. These are just examples, some things that really speak to who we are, and we still speak to who we are today, but then we're too tired to do it. And then when we go off on a weekend, like we're getting ready to do now, it's more about doing the things we couldn't do during the week, like the laundry, making sure the kids get all this other stuff and all. Where the heck do we come in? So maybe we can consider every day taking just a little time for ourselves, just to kind of, wait a minute, let me just relax. Let me just breathe a little bit. Let me just let out all that stress and tension in my body. Let that mind relax for a few minutes. Let me just take out a good half hour to just sit and be still and look back at what's going on with me. Can I put, for me, everything, personal, professional, whatever I'm going to do, I have to have it on the calendar. There's no way I'm going to remember everything. Not to mention that when you get older, you don't remember everything anyway. So if it's not in the calendar, it doesn't work. Just like if it's not documented, it didn't happen in the client progress note. Sometimes you have to consider how important you are enough to put yourself on the calendar. Not that the job was so much that, okay, now you have to change your day for some personal wellness time. No, prioritize yourself the same way you would a client for you. Think about what you're not doing before, that you're not doing now that you used to do before, and why. Because we get older, we get medical conditions, there's an array of other things. We have families, we're raising kids, but is it because we're too tired? The conditioning and the attachment that we form to our work and the people that we provide services to is great. It's just that we also have to give ourselves to. So self-care is about replenishing. So if it's physically, mentally, for some people, it's also replenishing spiritually, okay, emotionally. So it's really about what is going to help you go back to being in a place where you're grounded. Now, having a weekend is an absolutely awesome thing. I think that's why Happy Friday in the mornings on a Friday morning is kind of great. And that's why lately I've been in love with that on Thursdays, almost Friday. Happy almost Friday is like, oh, wow, a goal to go for. Makes me feel elated. Love it. Whatever works for you. Just that you can't forget yourself, because the most important person in all the work that you do is not the client, it's you. Because without you, you can't help the clients. And so self-care is a key. Let's see. I see some things. I do gardening and the beach. I remember when I was living in the Bronx, Section 13 was my favorite spot to be totally by myself in the beach. Totally by myself. Nobody ever went over there. The music was always at the other end. It's a quiet spot, or things that you intentionally do for just you. How is that about putting yourself as a priority? Every morning when I get home from work, go to my garden. Oh, that's fantastic. Go outside, touch grass. listen, we absorb a lot as empaths. We absorb a lot from the folks. And whenever I'm talking about having a trauma responsive environment, especially in the work setting, we're really talking about us having a space or an opportunity to be able to debrief. And so we can consciously do that in and outside of the job. You know, the job can support us in that, but we can support ourselves in that too. And not only for the job and not for our own wellness, but it also helps our relationships with those people we love, our kids, our partners, you know, our extended families. And so you're at the core of the universe. So you're at the core that's going to affect everybody else that's in that universe with you, you know, so we need you to stay healthy so you can be as ethically and objectively and as caring as possible and as individualized as you can be with clients that you provide services to. Okay, so let me see. Any last words or comments? So let me just give you this and share this. So the purpose of ethics is guiding behavior, ethics proof. They provide rules for how people should behave in the workplace or profession. I'm not going to say rules because everything is not black and white. It's more about guides and how to make informed decisions. And you shouldn't make those decisions by yourself, especially when there is dilemmas. Maintaining standards, protecting the public, and upholding integrity. And always, when you're at the best and the most grounded that you could possibly be, then that would look different after you're here for a number of years. But as long as you're being as most grounded as you can be, you're likely going to be the healthiest person that can help another individual, which is so amazing. And you folks like, this is it's not easy stuff.